Welcome back to Your History and Health Comes First. This is Dr. Richard Brown, and I'm going to talk to you today about the coronavirus some more. In my last podcast, we talked about the history of viruses and why it was so important to understand that. And so today we're talking about part two. We know that we're going into our third year of fighting this virus. And so we've learned a lot, but there's still a lot to be learned. Number one, it's not over. Number two, it's still here. Number three, continue to protect yourselves, okay? So again, for centuries and centuries, there's many famous people that I talked about before that have studied viruses and diseases and have invented vaccines, many of which have kept us alive and is responsible for civilization being able to thrive and operate as we do today. We've been battling it and we will continue to battle it. But what is the current status of this battle? And it is a battle, it is a fight. The virus is fighting to live and we're fighting to live. The virus is fighting to live so it can kill us, and we're fighting to live so we have to kill it. So it is a battle. Please make no mistake. And we all are soldiers in this battle. And so if you understand that, maybe you will survive and your relatives and your loved ones will survive during this time that we're in. So what is the current status of the battle? And what does the future look like? Well, today I'll continue my discussion on the virus versus humans and talk about what the current status is. So today, as of a couple of days ago, the count on the number of cases for coronavirus worldwide is 594,996,350 cases. That's a lot of virus worldwide. The death toll is 6,454,184. So 6 million people have died from this virus within the past 3 years, and people are dying every day. The numbers have gotten lower. Hospitalization has gotten fewer, but it is still claiming the lives of many. And in addition to that, the Centers for Disease Control and Prevention just announced about 3-4 days ago that they're easing back the quarantine restrictions and recommendations for people who aren't currently up to date on their vaccines. So likely fully vaccinated Americans, those who haven't received their primary series or recommended boosters, now do not need to quarantine themselves if they come into close contact with an infected person. CDC also said that people who test positive for the virus but are asymptomatic or they see symptoms improve quickly, they can isolate for a shorter period of time instead of the previously recommended 5 days. Well, that's their recommendation, although some others I've seen from school systems and some states, they still intend to implement the 5-day rule in isolation. And I would say, from my standpoint, as an individual, I would exercise that 5-day rule as well. So CD continues to say that people who test positive should isolate from others for at least 5 days, regardless of the vaccination status. The updated recommendations come as nearly 40% of the countries report a high COVID-19 level. Okay, so 40% of the country still has a 40% high infection level. Okay, Johns Hopkins University just recently showed data that reports that in 19 states, there's more COVID-19 patients this week than the week before, the week that they reported on. While hospitals in 20 states had more patients in the intensive care than it had the week before. So this thing is going up and down and giving people false satisfaction and false hope and false security that they can now just do away with all the precautions and go back to living a life of non-hygiene, non-safety, irresponsible behavior, which is not true. It really is not true. According to the author in this particular piece that I'm speaking from, he said, a positive sign that advances in vaccines and treatments have significantly lowered the risk of severe illness, hospitalization, and death from the disease, said Dr. Daniel P. McQuillan, who is president of the Infectious Disease Society of America. However, he says, with much of the country experiencing higher than 20% transmission rates, we cannot let our guard down. He spoke of the fact that the Spanish flu virus killed 40 million in 1 year in the 1800s. Now, our death rate is getting close to 1 million in the United States, but 6 million nationwide. But to show you how vicious and treacherous and how dangerous viruses can be, back in the 1800s, before we had these scientists discovering these vaccines, 40 million people worldwide died from the Spanish flu in the 1800s. So we don't want to ever get back to that, but it's possible if we don't act right and be smart and follow the science and practice safety. So what does the future look like? Stanford medical scientists explain that what we know and what we don't know about living with COVID-19 2 years after the World Health Organization had declared a pandemic. So as of March 11, 2022, Krista Kongor, who is a scientist and a writer of the Office of Communication, shared her thoughts in her article. She states that in 2 years since the World Health Organization declared COVID-19 a pandemic, we've become armchair experts on genetics, virology, immunity, the circulation of aerosolized particles, and the Greek alphabet of soup of coronavirus variants. The alphabet, she's speaking of the beta, then the delta, then the Omicron. Yet no one knows with certainty what on the horizon. And what does it mean for a virus to become endemic? Now, we've had a pandemic. At this point, they're declaring that it has decreased enough that they're now calling it an endemic, which means that it's enclosed within the borders and in the surrounding areas locally in countries and or in neighborhoods, all the way down to neighborhoods. So they're declaring that it's endemic now. But how long does immunity from vaccinations or infections last is the question she's asking. When you wake up with a sore throat in the morning, what type of test can you take to determine whether you have COVID-19 or whether you just have allergies? Do you still need to wear a mask, she's asking. And almost the most important issue is, when will this thing all end? Well, nobody knows. But if we focus on what we do know, we know that it could come to some conclusion, some close conclusion, but it absolutely will not if we don't behave the way that we should behave. So right now, she goes on to say that the virus is trying to arrive at a successful strategy, meaning that the virus is continuing to try and figure out how to multiply within humans. And this is reported by David Wellman, who is the professor of microbiology and immunology, and a former president of the Infectious Disease Society of America. He maintains that viruses just want to replicate and persist in the population. And what this virus looks like 3 years from now is probably still different than what it will look like 5 to 10 years from now. So he's telling us it's going to be around. The future is that the viruses will be here because the viruses only want to replicate and persist inside the population. So since March, as I mentioned earlier, this author talks about the fact that 6 million people have died of COVID-19 in the United States alone. That's worldwide. In the United States alone, there's been at least 1 million. So recent changes in the guidelines have come about because the public has begun to start not wearing masks, begin to start gathering in large crowds again. A lot of people have gotten vaccinated, so there's less virus out there being transmitted, but only about 70% of the population has been fully immunized. And so, because death rates have gone down a little bit, people are returning to business as usual. And business as usual is going to be unusual during these unusual times. So we'll never go back to the business as usual as it was before the virus came along. There's lots of modifications taking place, including a lot more people working from home, and will probably be demanding working from home because they feel safer there. And then gas prices have gone through the roof as well, so you can save some money by staying at home too. Now I can remember, 20, 25 years ago, it was blasphemous to talk about staying at home and working. That was absolutely not acceptable amongst most mainstream corporations. But anyway, there's no sign that the virus is going away anytime soon. Nevertheless, many of us cling to the hope that the harm it can cause will decrease, and that COVID-19 will be nothing more than a worrisome cold. This scenario is what many people think of when they hear the term endemic. But in reality, endemic doesn't mean harmless. Let's think about tuberculosis and HIV, two well-known endemic diseases. Together, they cause millions of deaths each year, not only in the United States, but around the world. Another endemic disease is the influenza that I mentioned earlier. Now, it only kills hundreds of thousands of people globally each year, but it also periodically mutates to cause full-blown pandemics. Again, like in 1918, the Spanish flu killed 40 million, almost 50 million. So even though we have a vaccine for the flu, and had a vaccine for the flu for some years, we still have to continue to get the flu shot because the virus is still out there and it is continuing to mutate and continuing to change so that it can get inside our bodies and live. So indemnity is not certain either. Now, what is indemnity? An endemic relationship speaks to the degree of adaptation that allows a stable coexistence. This was reported by Relman. He said, in many cases, epidemics fizzle out after a year or two if the infectious agent is unsuccessful in establishing this relationship. That's this endemic relationship. It's a real crapshoot to see if COVID-19 will adapt successfully, and that we will need to watch and wait and see if this really happens. Herd immunity is a term you've heard, I'm sure. So herd immunity takes place when the viral transmission is effectively stopped because enough people in the population have become immune. It's another term that's hopeful. It's a hopeful term, meaning that People hope that we will all become immune through herd immunity. So immunity can be achieved either by recovering from infection or by getting vaccinated against COVID-19. But that immunity appears to wane within weeks or months. It seems to disappear or becomes less weak within weeks or months, leaving people unsusceptible to being safe and more susceptible to reinfection or breakthrough infections. So when we talk about herd immunity, you have to ask yourself what that really means on a global population level, says Relman. Whose herd immunity, whose herd do we mean? And to what degree of immunity? The unvaccinated will eventually accumulate some degree of immunity, but we may well continue to see unequal outcomes in severe disease and deaths between vaccinated and unvaccinated people for a great period of time. So there are those that are getting vaccinated and those that are not getting vaccinated. We know that there's going to be deaths, lots of deaths that takes place between those who are unvaccinated. Those that are vaccinated, there may be a few, not a whole lot, that may die, but at least they've given themselves a chance. They didn't gamble. They didn't gamble with their loved ones. And so the best thing to do is to get vaccinated, of course. That's what the scientists say. That's what common sense says. So as of March, the Centers for Disease Control reports that 65% of the US population was fully vaccinated, but only 50% of those eligible for boosters had received one. So we got the vaccination. Within 1 year, December 2020, we had the vaccination. And now we've got boosters that have been developed, but only 50% of the population are getting the boosters. And as we sit now, there's a third booster that is available, and they're working on additional boosters. So some vaccine hesitant people feel that immunity obtained through infection is preferable to vaccination. So immunity obtained through infection means that, rather than taking the vaccine, they'd rather get the disease and hope that their immune system kicks in and helps them to fight off the disease, rendering them then immune. But it's a real gamble. Some people's immune system isn't as great as others. And one person may get the disease and die within days or weeks. Another may survive and may get infected a couple of times and still survive. But you don't know who you are. If you're a person that's living an unhealthy lifestyle and participating in risky lifestyle behavior, chances are your immune system isn't going to protect you and save you. So why gamble? There's no need to gamble when we have the means by which to protect ourselves. Many scientists have studied and worked hard and have perfected the infections, the immunizations against these infections. So no one can predict what their bodies will do. You're taking a chance. If you were told that bungee jumping, if you did bungee jumping, that the chances of you dying was 0.5%, would you bungee jump? Well, a lot of people will, and a lot of people have, and some people have died from bungee jumping. Would you fly in an airplane if only, 50% of the planes got to their destination without crashing? You would not fly. If there were not stop signs at the intersections and you decided to go through those intersections, then there would be crashes all the time and lots of people would die on a daily basis. But we have stop signs, we have traffic lights. but still people go through those lights and through those stop signs for whatever reason. And that is analogous to not taking the vaccine and taking your chance of going through a stop sign without getting hit. Oh, you'll last maybe a few times, but at some point, odds and statistical rationale says that you will run into somebody else who thinks just like you. And so you all will die. Those of you who aren't getting vaccinated, many of you will pass away. And some people say, oh, you got to die from something. Yeah, that's true. But science has brought us to the point now where we can live to be 100 and over 100. But when you look at the newspaper, I challenge you to do this. Next time you pick up a newspaper, especially a well-known newspaper on the weekends, look in the obituary section. And what you will find is that there's people in there that are dying. And what is their age? The average age of people in the obituaries is like 79, between 79 and 89. So that's how long people are living in general right now. But science is such that you can live longer there. There are babies being born now that will live to 120, maybe 150 years old because of the technology and the science, if they follow it and if they live a healthy lifestyle. So, with where we are, we must be smart. The Stanford College is doing a lot of studies now in the laboratory, and they've completed 1 million PRC tests for COVID-19. And last week, the laboratory launched a new test to track antibody levels in infected and vaccinated people. A critical way to monitor how immunity wanes or how it dissipates is why they're doing this. The lab is the first among regulated clinical test laboratories nationwide to offer this test. This is the same assay that was used during the clinical trials for COVID-19, and it is calibrated through the World Health Organization. Until now, these assays from different companies would give varying results that are difficult to interpret. Now we'll have harmonized data that can be used to guide clinical and policy decisions. The test is primarily being used to determine whether immunocompromised people have mounted a protective antibody response after vaccination, and to identify those who may benefit from additional boosters or who are greater risk of severe disease. Pardon me. Of course, whether a vaccine will provide protection also depends on the degree of exposure a person has to the virus, said Scott Boyd, MD, PhD, Associate Professor of Pathology, who recently published a study with research scientist Catherine Roentgen. If you're sitting 2 feet away from a highly contagious person and neither of you are wearing a mask, you will have more exposure than if you were still masking and distancing. But how do you know if you're contagious or even infected? Penske cautions that although at-home rapid tests or antigen tests are useful, they have their limitations. And this is important because lots of us have rapid tests now. Matter of fact, the government provided home tests to everybody that's 65 years and older on Medicare, I'm sorry. So people need to remember that a negative test result does not rule out an infection. They are useful only when the result is positive. So if the rapid test is negative, you could still be infected and you could still transmit the virus to others. So he believes that it's hard for people to wrap this around their heads, that if the test is negative, it does not mean you do not have the disease. Okay, you still could have the disease and you can still infect people. But if it's positive, you know that you are infected and that you need to take precautions. You need to isolate. So antigen tests are being developed as well. So antigen tests can be used to track the course of a known infection, and they can facilitate an earlier release from isolation and return to work. Those tests are given after you've had the disease and your body has developed an immunity against it. Then there should be some antibodies that are excreted in the bloodstream, and so you can find out whether or not your immune system is working. So do we wear a mask or not at this point? I say to you, you should wear a mask in public places. You should wear a mask among people that you don't know. Whenever you don't feel well, or you know you're around people that are sick and not feeling well, you should wear a mask because the virus is there. You must assume that everybody is infected. At some point, we're not going to be isolating everyone who has COVID-19. That's going to change because we're back out there and the rules have changed. I mean, for example, we don't test everybody who has the flu systems during influenza season just to see if they really got it or not. We don't test them because we assume that, well, if they have flu symptoms, they probably got it. They need to stay home or get some medication. Same with this virus at this point. Just because you have the symptom, they won't even be testing you to see if you really got it or not, according to the researchers that did this particular article, because it will be kind of common, and that's going to be part of the new reality of the future. So as these mask restrictions are rolled back, the burden of the disease prevention has fallen more squarely on those who have the most to lose. The immunocompromised people and those children of those parents who have children that are too young for the vaccination. So, leaving the mitigating efforts up to people at high risk means they're going to need even higher levels of protection. And what that means is that those that are higher risk are going to need higher levels of protection because the rest of the population is going to fold into kind of going along as accepting that we've got the virus here and I'll get it and I'll get over it, or I'll miss a few days and I'll keep moving. But the virus is going to still be out there jumping to those people that are most vulnerable, the immunocompromised. And so those people have to protect themselves. That's the elderly. That's people who have various illnesses, people who have to go out into the community because they have to go to work. You got to protect yourselves. Even though other people are not wearing masks, you may need to have to still wear a mask because you got to go out and be among people who are infected. So this author talks about the need for more highly quality N95 masks. And those just in the beginning who will be able to get those high quality N95 masks are going to be those who most likely are not in the vulnerable group. The equity just is not always there. They try, but as this thing goes on and on and on, the equity isn't going to be there. The public health system focuses on the broad population, on the broad human existence. And life has to go on. And so those that are most vulnerable have to protect themselves, as has always been. The poor and those that are without jobs and without the means to take care of themselves or their family, they have to get it the best way that they can. The government, private society can't take care of everybody and don't want to. They will help along the way if they can. So this disease is leading us to come down to something that most people that live now have not been faced with, which is that no one's coming to take care of you. You got to save yourself. The long game. The long game is a topic that's mentioned in this particular article. He talks about excuse me. The trauma of the pandemic has taught us valuable lessons and reinforced some that we already knew. The next pandemic won't be a surprise. At least no infectious disease experts believe this. We've seen multiple outbreaks of newly emerging diseases over the past 50 years, including several other coronaviruses. And it happens as predictable as lightning striking in a forest, he says. We're going to need to think smarter and move faster. Airborne viruses are particularly difficult to combat. We need long-term solutions like increased air filtration in workplaces and in schools, and we need access again to high-quality, reusable masks. We may even get to a point where we're wearing those masks like you've seen in those old movies that the entire population is wearing them and they never take them off. So half of the available vaccines have gone exclusively to the high-income countries, while over 75% of the people who live in sub-Saharan Africa have little or no access to even places to wash their hands. So the equity situation is going to continue to be unequitable, which again, you must think about saving yourself. So as we're going to continue to get better at making new vaccines, the viruses will continue to get better at mutating. And so we must save ourselves is the major message. Even with these advances that scientists have made and are still making, most of us will probably have more COVID-19 vaccinations in our future. Until we learn how to enhance the durability of vaccines, including immunity, we may very well need boosters every single year, according to some of the scientists that are writing about this and studying this. One scientist by the name of Poolandran states that there will certainly be COVID-19, 20, 21 through 29, and maybe even COVID-50. So we will continue to keep our eyeballs open and on the ball and innovate new vaccines that are globally accessible. So how many of these viruses will we have to combat? Nobody knows. What will it be next year? We don't know. We've only been into this one going on three years. But what we've learned during this time is that these viruses are here. They're dangerous. They love to multiply in its host and then kill its host and then jump to another. So thank you for joining me today, and always remember your health and history comes first. This is Dr. Brown, and I'll see you around.
This has been Your History and Health Comes First with Dr. Richard Brown. And you can leave suggestions at ewcfacts@gmail.com. That's ewcfacts@gmail.com. This has been an EWC Communication production.